Patient had a nice even gait with easy movement and good posture. Handshake was firm, eye contact was established. I introduced myself, explained that I would be assessing his musculoskeletal system, and checked his armband for identification. The patient shows no signs with vision, can sit, stand, and no difficulties with vision, can sit, stand, and rise with ease. Hears and understands me when I speak English, is alert and oriented ×3, interested and involved with his care, dressed appropriately, shows no signs of shortness of breath, and appears to be of healthy weight. I have all of my proper equipment. To get the patient's history, I'll ask about biographic data by getting the patient's name, date of birth, occupation, gender, and marital status. I will ask about the patient's reason for seeking health care by asking about the chief complaint, and then get the history of present illness by assessing him using old cards. I will get the patient's past history by asking about recent surgeries, hospitalizations, immunizations, accidents, last exam, childhood illnesses, and obstetric history. I'll get the patient's family history by asking if any chronic illnesses run in the family, asking about family and social relationships, and I'll get the patient's personal status by asking about diet, illicit drug use, health promotion, smoking environment, and functional ability. I'll get the patient's psychosocial history by asking about health promotion and mental health, review systems, getting general symptoms, head and neck, integumentary, chest, respiratory, cardiovascular, GIG, reproductive, musculoskeletal, and neural systems. I'll get patients' vitals by getting respirations, blood pressure, pulse, temperature, visual acuity, pulse ox, pain, height, weight, and BMI. I'll prep the patient by giving him a gown, asking if he needs to go to the bathroom, and getting any specimens if needed. To start the assessment, I will have the patient stand up, assessing his axial skeleton and extremities for alignment and tenderness. I'll inspect the patient's muscles for size and relative symmetry. He'll get palpate the bones for tenderness using pads of my fingers and thumbs. I'll observe range of motion in major joints and adjacent muscles for tenderness on movement by having the patient flex and extend, abduct and adduct the muscles, and I'll observe joints for stability and deformity. I'll test muscle strength by having the patient push and pull on my hands, and I'll compare sides. I will observe the patient's gait by having them cross the room and come back, looking for conformity, symmetry, and rhythm. I will inspect muscles of the face and neck by having the patient smile, close, and open their mouth. And lastly, I will inspect the temporal mandibular joint upon movement, looking for sounds, tenderness, while the patient opens and closes their mouth.